We do DNA biopsies on root canal teeth that we extract. We can use DNA biopsies on tissues that are infected. And why do we do this? When we're working with a patient, we want to help them achieve the optimal levels of health. If somebody has had an infection on the jaw for years, they had a root canal done 10, 15, 20 years ago, and they have had an infection growing on the jawbone for all that amount of years, we find that when we remove the tooth and we send it for a DNA biopsy, the patient is going to get a full report of all the microorganisms, the amount, the level, the toxicity level, what these microorganisms actually the impact in the body. They're going to get a scientific report of microbiology. And we find that is so useful because we remove the infection, right? We remove the tooth, but the patient has all these microorganisms going through the body. It helps them and the doctors that refer them here to develop a strategy of detoxification. And not only that, they have found, I have a patient that has COPD. We removed the teeth that were connected to the lung meridian. When we got the biopsy, it had the pneumonia streptococci. That was the same bacteria that they found her blood was on the teeth. What happens is once we did that and we got it out and we cleaned her out, she did hyperbaric. The doctor couldn't believe that her blood, everything cleared out. She couldn't breathe. COPD, a young woman, connected to the teeth. She was not a smoker. She's a health coach. She couldn't find, why am I so sick? I cannot breathe. She's always coughing. So it's really rewarding for us, and it's scientifically, I have to back up, why am I removing this root canal, right? So this is an infected tooth. There's no doubt that it's infected. But I want to take it to the next level and say, okay, what else can we do? The patient got on intravenous vitamin C protocol. That helped her clear the infection out of her blood. And also, in conjunction with hyperbaric, the stem cells, the bone marrow produces a lot of osteoblasts and collagen fibers to be able to repair the site. So it's a win-win-win. And that's why we do DNA biopsies.